Hey y'all, this is Sabas in the house and welcome to my YouTube channel where I talk about surgical nursing, medicine, and everything life in between. My name is Francis and I am a registered nurse as well as an acute care nurse practitioner student and a registered nurse first assist student. Today we're going to be talking about how to find your own surgical preceptor. It doesn't have to apply to only students who are looking for surgical preceptors, but any other advanced practice provider student that needs a preceptor that isn't provided by their program. So before I talk about this topic, make sure to check my previous video, which is my very first video in which I introduce myself. I talk about the RNFA role and the nurse practitioner role in the first assist. So let's get right to it. So I'm going to talk about the purpose of the preceptor, what are the goals that you need to establish with your preceptor, and how to find one in this video. So why do you need a preceptor? So a preceptor is supposed to serve as your official designated mentor. It can be either designated by your program or your school, or if they're not provided by your program or school, this could be something that you can find along the way throughout your academic career. The preceptor's role is supposed to introduce you to the field that you see yourself practicing in the future. It's supposed to kind of establish what type of field you want to work in. More importantly, it's supposed to give you a first-hand exposure to treating patients in the clinical setting. I love clinical rotations or preceptorships because it gives you a true, accurate depiction of how a patient can truly present with. Again, it's really important to note that not all patients present the same as they do in the textbooks. Every patient is different, and so it is important to note that clinical rotations or preceptorships are not intended to be a replacement for didactic learning. They're supposed to be a supplement. They're supposed to kind of go hand in hand and help you retain information and ultimately to treat the patient. In fact, all programs, both the NIFA and most school first assist programs, require you to find your own preceptor, which can be quite a challenge, and I'll help break it down to make it easier for you guys, okay? So one of the first things that you should establish before you try to find your own preceptor is make sure you know what field you see yourself practicing in. So for me, I chose cardiothoracic surgery and or cardiac surgery because those are where my passion. Luckily for my program allows me to precept either not just a surgeon, but can be an NP or a PA, depending on the approval of the surgery team. So I would clarify with your program what types of preceptors you can have. Does it have to be a surgeon, or can it be another advanced practice provider such as an NP or a PA? One of the most important things that you want to establish once you find your preceptor are the goals and the objectives that you have as a preceptee in terms of your learning experience. And you want to establish this very early on when you find your preceptor, so that way there are no miscommunication and that both parties, benefit from this experience. You want to be as a preceptee, you want to be very clear in terms of what your learning experience entails. So for me, I needed to learn specific procedures. I also wanted to be in charge of learning how to take care of patients in the pre-op and post-op setting. For me, another thing that I needed to find out was how many hours I needed to devote in this preceptorship. For me, my program requires me to have 270 hours in the operating room, as much as possible. I chose to not devote all 270 hours in the operating room because I want to devote a little bit of time in the radiology department, learning how to read chest x-rays, learning how to read CT scans, because I think it's equally important to learn how to read radiology just as much as learning the procedures so that you can truly understand your patient. So lastly, I want to cover, how do I find my own preceptor? So I'm going to do a little screen share through my computer, and I want to show you a step-by-step process of how I kind of organize my thoughts and how I organize my list in terms of, narrowing down how I found my preceptors, because it's going to be a difficult journey, especially if you don't have any exposure to the operating room and you haven't established any connections beforehand. I want to make this process as smooth and as the least overwhelming way possible, because I had no support myself and I had to do everything myself. So let's get started. So here you'll see me I use a program called Notion in terms of organizing my list of the programs that I've called and contacted, and I'm not sponsored by them, but it's a great program for organization. And then here you'll see just how I kind of Google programs around my area. So I look up cardiac surgery in the Massachusetts area, and I even look up cardiothoracic surgery and see, compare what kind of programs come up when I do different searches. And here you'll see me just browsing through the list. I'll even click on the map just to kind of see physically what, within the vicinity that I am, what kind of programs are out there. These are definitely some of the programs I've reached out, but does not reflect necessarily which one I picked and which residency I found. And yeah, let's click on the first one. This is from Mass General Hospital. We all know it's a very world-renowned hospital institution. I would, read about the program, what kind of procedures they do, and then most importantly, I'd obviously look for the contact info. And, when you look at the contact info, you want to look for the phone number, any emails that you may be able to kind of reach out. And especially you want to get information of the person that's, that may be in charge of the program. If they do offer first assists, make sure you get those information. Usually it's from the provider themselves or from the unit program or the unit coordinator or the clinical coordinator. And then here's just quickly an email of what I've conducted in terms of sending out to preceptors. Just an example, stating who I am, my current role, and what I'm looking for in terms of my hours and what kind of program I need. I hope you guys found this video helpful in terms of finding your own preceptor. If you like this video, feel free to give it a thumbs up and press the subscribe button, and also feel free to leave comments down below if you have any questions. Sorry, excuse my sweater right now. It's starting to get a little cold here in Massachusetts, but here we are. Anyways, I'll see you guys in my next video, alright? Bye.